I was just checking my morning news and saw the story just released today, December 12th. Surgery wait time lists longest in 18 years. That's nationally. Haven't really looked at to see exactly where Alberta is on those figures, but I know I'm waiting for torn rotator cuff repair on my left shoulder. Being a wheelchair user, that presents unique problems because when they strap your arm across your chest like this for 4 weeks while it repairs, you're pretty well out of use in a wheelchair. The bigger issue is I use my arms for everything I do. As a polio survivor, my arms are my legs. So they have been repaired before. That was about 12 years ago. A lot of wear and tear on my shoulders. They need to be repaired again. Something I'm not really looking forward to, especially in light of the last 41-day visit I had at a hospital here in Calgary. But when this surgery was requested, which was last spring, and I saw the letter that my family doctor got back from the surgeon that said it could be up to 36 months before this person can see me, who I had seen in the past, by the way. But 36 months, that's 3 years. That's a long time to wait for surgery. Now, knowing that that type of surgery, the last time I had it, I wound up in hospital again for over 4 weeks because I couldn't use my arm. Well, since I was going to be in hospital after this accident, I was there 41 days all total. I raised the issue in the first week after finding out about how long I'd be there, because there was a fracture in the hip and it was more than I had anticipated. And they were talking 4 to 5 weeks of bed rest. I said, well, wouldn't this be a good time then to do my shoulder if I'm going to be in bed for 4 to 5 weeks because of the hip? Why not do the shoulder as well, and we can all get it done at once? And that way I don't have to take up a bed later on, wait who knows how long. But it just, to me, that seemed like the common sense approach to tackle this. Well, the response I got was that, well, no, shoulders are done at the Peter Lougheed or the Rocky View. Hips and knees are done at McCaig Tower in the foothills, which is where I was. I have a little bit of an issue with that, and that how can you compartmentalize a body that way? Ran into a similar situation with a gentleman in the bed next to me. The doctor had wanted to do a PSA test while he was there, and was basically told, well, there's no sense in that because the Rocky View is the urology hospital, and they couldn't get urologists to come over to the foothills. Well, what kind of system is this? So I'm saying this to doctors out there as well. I did talk with the orthopedic person I was dealing with, the surgeon at the foothills. She's been around for a while. She's worked with polio. I said, do these doctors really understand the effects that something like polio has on a body, and that it isn't just a hip, it isn't just a shoulder? There's a holistic avenue to dealing with these bodies. I was constantly having to teach people while I was there, 4 weeks into it, explaining to people why I couldn't get up and walk with their assistance to the bathroom. I haven't been able to walk since I was 3 years old. I don't think it's going to start now. But all of that was on my chart. I think they were more interested in recording the videos I was posting than actually talking about the physical complications of what I was going on, or what was happening. Anyway, but not being able to get the shoulder done while I was in there, it just struck me as a real waste of resource. What has happened to common sense in our healthcare service? If I'm going to be taking up a bed for 4 to 5 weeks anyway, would that not seem to be the time to get that surgery done? This one hospital doing one and another hospital doing something else is just insane and doesn't lead to effective surgeries, doesn't lead to effective hospital administration. And anybody that's worked beside a bed will know that. So, wait lists getting longer, I'm not surprised. A big part of that is due to loss of common sense over the last 20 years in healthcare, and specialties that have gotten so refined they can't see past the joint they're working on. Anyway, that's my little rant today. You want to shorten wait times? Try and doubling up things. When I take my car in to have it tuned up, I don't just have the tires done. I have everything done at once. It's cost effective, time saving, and better for my car. Anyway, that's it for today. Get to work, Alberta Health Services. You're really dropping the ball here.